I'm Dr. Matthew McNutt, orthodontist. Thank you for visiting our before and after collection. We're going to discuss impactions of permanent teeth and how orthodontists help to bring impacted teeth into the mouth into alignment. On the screen, you see an illustration of teeth. The highlighted yellow tooth represents an impacted canine. Now, impaction simply means that the tooth is unable to erupt, and its path of eruption may also have altered. In this case, you can see that the canine is sitting at an angle, and it's sitting just behind the roots of these permanent teeth here. Impacted teeth pose a problem for several reasons. An impacted canine such as this one is actually a risk for causing problems with the roots of other teeth. These permanent incisors here could potentially be damaged because the impacted canine continues to erupt off course and damage the roots of those permanent teeth. Typically, impacted teeth will not erupt on their own and do require the help of orthodontic treatment in order to put them in their proper position. Upper permanent canines tend to be the most commonly impacted teeth, and as you see in this illustration, this gray tooth, representing the baby canine, often remains in place while the permanent canine is impacted. Most permanent canines that are severely impacted, like the one you see here, require the help of another dental specialist known as an oral surgeon. The orthodontist will write a special referral form asking the oral surgeon to place an attachment on the impacted tooth, and that attachment is used by the orthodontist to slowly bring the tooth into place. So let's illustrate. First, braces might go on, and then the removal of the baby tooth occurs, typically at the same time as an attachment, as you see here, is bonded or placed by the oral surgeon. This attachment reaches through a small window in the gum tissue and is attached to the braces. Slowly over time, I can apply an eruption force on the tooth until eventually it comes into the mouth. After that, regular braces can be applied to the canine tooth and it can be put in place. Correcting an impacted canine can take a long time. Patients with severe impactions may be in braces for 2 years to sometimes even 2.5 years. One of the reasons it's important for children to have an orthodontic evaluation, usually between the ages of 8.5 and 9, is to evaluate how the permanent teeth are developing and make sure that they're erupting properly. Oftentimes, a canine shows early signs that it might drift off course and become impacted as it develops. When the orthodontist looks at a panoramic x-ray and looks at the positioning and the root development, he or she can help make decisions for the patient as to whether or not interceptive treatment should be considered in order to help minimize the chance that a canine is going to become impacted. Sometimes that early treatment is nothing more than the recommendation by the orthodontist to have some baby teeth removed early in order to help guide the canine into a new eruptive position. So let's look here at this illustration. On this side, we see these upper gray baby teeth, as well as on this side. Here is a developing permanent canine, as well as here. So as we go slide by slide, what you'll notice is this one develops in its proper position and comes down over this baby tooth. This one begins to drift off course, putting at risk the roots of these permanent incisors. And as a result, these two baby teeth are removed in order to create a path of least resistance so that this tooth can erupt down and in. So let's start our illustration. So we start to see that this tooth is starting to drift a little bit this way, whereas this one is staying just over the baby canine. We're starting to almost see some overlap of this incisor root with this canine tooth. As a result, it has been recommended to remove these two baby teeth. This tooth is continuing to go off course, but now that it has an open path of least resistance, there's a very good chance that over time it will self-correct and come into the proper alignment. This is one of the reasons it's so very important for all children to be evaluated in order to look at what is developing, what is erupting, are there any problems that need to be addressed. Many canine impactions can be avoided with a proper referral from a dentist at the proper age so that the orthodontist can evaluate the position of the developing teeth and help guide any eruption problems. Sometimes, despite the best effort of your family dentist and me as an orthodontist, there are teeth that are going to be impacted no matter what we try to do. It might be that the upper dental arch is very narrow. It could perhaps be because there is moderate to severe crowding. And even the removal of some baby teeth to help guide eruption just won't be enough. In those severe situations, it may be warranted for me to recommend early interceptive orthodontic treatment in order to create room with braces or perhaps even an expander on the upper dental arch to create extra room for the canine to be able to have a place to erupt into in the future. I hope this answers any questions that you might have about impacted teeth and the importance of having an early evaluation by an orthodontist to make sure that all the teeth are developing properly and erupting into their proper spaces. Thank you very much.